Dear friends, in this lecture I demonstrate how to improve diagnostic in COVID-related disease by using heart rate measured by wearables. In our research, we used a different device to measure heart rate and heart rate variability. Most of all, we used a 24-hour Holter ECG, but in some cases, it's better to measure a short-term HRV using the Biozyne device, or in the intensive care unit monitoring, we use our monitors to analyze heart rate variability. In this lecture, I want to introduce in the possibilities to measure heart rate variabilities with wearables. There are important limitations to measure heart rate variability based on technical challenges. In summary, it seems to be easy to measure the heart rate during long-term and short-term measurements using the ECG or the pulse wave. It is relatively complicated to measure vagus activity, of course, artifacts, and it seems to be better possible to measure global heart rate variability by using some algorithm. In the lecture, I introduced two algorithms to improve risk stratification and to improve measurement of physical performance. In the first part of this presentation, I demonstrate the HRV analysis in acute COVID-19 in a 58-old patients who suffer from the disease in April 2020, and the data are published in May 2020. The special circumstances of this publication is that we have baseline HRV data from 24 Alta ECGs from 10 years before the disease, and we clearly see the collapse of the global HRV in this man with very low heart rates and very low heart rate variability. We publish this data and speculate that in patients with COVID-19, the global heart rate variability collapsed without the expected heart rate increase during infections. We developed an algorithm as shown in this chart using the circadian heart rate difference between the mean heart rate at day and night and the global heart rate variability using the parameter SDNN. By using normal values, we see the progressive decline of these parameters with increasing age. And we published this algorithm in this paper. Our observation was confirmed in this publication some months later, showing in persons with using wearable device, and we see in the red line that the heart rate increase at the beginning of the disease and decrease below the baseline data from the 5th to 20 day, as we have published some months earlier. The Apple Watch investigators used this observation to develop an algorithm from the smartwatch using the circadian heart rate variability, and it's clearly shown that healthy persons who don't develop COVID-19 have a much higher amplitude of heart rate, circadian heart rate variability, and these data collapsed during the disease, and we can clearly see that the amplitude divide the two groups in this analysis. In a further publication, these data are used to analyze heart rate variability after BioNTech vaccination. The difference are not significant in the most parameters, and there are some evidence that probably vagus activity decrease after the vaccination, but these data have to be approved. What about heart rate variability during follow-up of COVID-19? We have the opportunity, of course, our online heart rate variability monitoring on our pediatric intensive care unit to observe the heart rate variability of an 8-year-old boy who developed the multisystemic inflammatory syndrome. Again, the heart rate variability collapsed during this life-threatening disease. If he received IVIG infusion, the heart rate variability immediately improved and the heart rate dropped down and the boy is healthy again. This publication of Stolberg et al. Confirm our interpretation of long COVID as as a disease of the autonomic nervous system with well-known entities like the post-oral orthostatic tachycardia syndrome and an inappropriate tachycardia, as shown in the next cases. This chart shows our own unpublished data from adolescents with autonomic dysfunction. The group of inappropriate sinus tachycardia published in PLOS ONE have elevated heart rates and decreased heart rate variability clearly shown in heart-failure analysis. The group with post-oral orthostatic stress syndrome have an increase of the heart rate while standing above 40 beats per minute with normal heart rates while lying and elevated heart rates while standing. The group with vagovasal syncope have no significant difference to the control group. However, there are some data from the literature who show that probably patients with vagovasal syncope have slightly elevated increases in the active standing test. That is not confirmed by our data. On the other hand, there are some data who may show that the mean heart rate is elevated in the 24-hour heart rate ECG in patients with post-oral orthostatic tachycardia syndrome, but we see the different heart rates of the healthy control group that in part are too low for a normal healthy control in adolescents. This is our first published case with long COVID in adolescents. After mild disease, the 16-year-old girl collapsed immediately after standing in the active standing test. She received propranolol and have a clear clinical improvement, but again, after 2 minutes, she collapsed with a vagovasal syncope. There's a reason why we have to stop propranolol and treat with omega-3 fatty acid for 3 months, and she completely recovered. This is the first case of an adolescent with post-oral orthostatic tachycardia syndrome after COVID-19 vaccination. 2 weeks after vaccination, she isn't able to visit school, and she had a hospital stay with no results. Using this 24-hour Holter ECG, there's a clear increase of mean heart rate to 96 beats per minute with a normal pressure. She have no activity in the activity sensor, and if she have activities in the sensor, the heart rate increased to values above 114, and she stopped the activity in the afternoon, she laying down during the whole time. She received ivabradine 2 times a day, and the heart rate dropped down to 70 set beats per minute, and she recovered and have more activity during the day, in the evening, and as well as in the morning, and the blood pressures remained normal. These data are well demonstrated in the active standing test. There is minimal change during the lying position, but after standing, the heart rate variability increase after 2 weeks and after 6 weeks, and she received further ivabradine for 10 weeks after the diagnosis. This is again a girl who had long COVID syndrome 1 year after mild COVID disease. She received a lot of diagnostic without a diagnosis, and again in the 24-hour Holter ECG, we see the highly elevated heart rate from 104 on average, with a slightly higher blood pressure. She received propranolol if she don't tolerate ivabradine, and the heart rate dropped down to 85 beats per minute, with a slight improvement of the symptoms. Again, in the active standing test, there is a decrease of heart rates while lying and while standing, with an increase of heart rate variability while lying, with an increase of heart rate variability while standing. These observations are confirmed in the fast Fourier analysis, with an increase of heart rate variability in all spectra while lying and standing. However, the data while standing are very low, and the girl have further problems. We analyzed their autoantibodies and found clearly elevated thyroid peroxidase antibody and thyroid receptor antibodies that show that the girl have developed Hashimoto disease. We hope to better improvement of the symptoms by treating this disease. The reason for the autonomic dysfunction seems to be elevated G-coupled receptor autoantibodies, as demonstrated in children after the disease with multisystemic inflammatory syndrome, as well as in children who have long COVID, as well as in children who have problems after vaccination. These data are published in Vaccines this month. With last cases, I demonstrate that autonomic dysfunction is widely ignored in modern medicine, and we have problem to manage the second pandemic of autonomic dysfunction if we further ignore these problems. And probably it is your chance to use wearables to make your own diagnosis and perhaps to understand your problems. In the next videos, I want to demonstrate how to diagnose it by the wearable if the companies use our algorithm, and probably control your own therapy that is possible with omega-3 fatty acids, beta blockers, ivabradine, and some other new drugs that have to be discussed. Thank you for your attention.